All right. Hello and welcome to the Lehigh Valley with Love podcast. This is our off the record series. We're here for episode 2, talking about mental health. I am your co-host, George Wacker with Lehigh Valley with Love, here with my co-host, Jeff Warren. Jeff, how you doing?
I'm doing great, George. It's great to see you. It's great to see our guests that are here. I'm really looking forward to this episode. Mental health is such a crucial topic. And as someone who has personally benefited from therapy myself, I'm very excited to hear the unique perspectives of our guests today. Got a fantastic lineup of folks, and I think our listeners are going to take away some real insights into the challenges and opportunities here in this space.
Yeah, we had some great feedback on our first episode. If you haven't seen it, go check it out. We talked to some local politicians who gave us some more insight on the ways that they're combating mental health and trying to get more resources locally. And today we're talking to some professionals, and I'm going to have them introduce themselves. We're going to start with, we'll start in the top corner. So Ronnie.
Hi, everybody. Happy to be on. My name is Ronnie Nase, and I am the director of the Clubhouse of Lehigh County.
And Amy?
Hi, everyone. I'm Dr. Amy Saborski. I run Lehigh Valley a Center for Child and Family Development. It's a private psychology practice. And also in the last year, my husband and I opened a community center called Pieces of Mind, which also integrates mental health into the community.
And Jacquelyn?
Hi, I'm Jacquelyn Otto. I'm a licensed professional counselor here in downtown Bethlehem. I'm the owner and therapist at On Track Counseling.
All right. And Jeff, I wanted to jump right into it kind of with a high level question.
Go ahead, George. Yeah, go ahead, buddy.
What do you feel like is the biggest mental health challenge in the Lehigh Valley right now?
Man, loaded question.
Anyone can jump in on this.
I don't mind jumping in. I think the biggest thing that I run into, which I'm sure some of the other individuals may agree with, is definitely availability. Even though we are, a really good community and have a lot of options, we're still very saturated and a lot of availability just isn't there, especially for evening appointments, adolescents. And then the big one that you may have touched on in episode 1 comes to funding and having the resources, to engage in those services and have the ability to pay for them. Yeah. So I bet definitely just being able to find people that have open availability.
Yeah, I second that. I think, not only is it availability with like evening hours and things like that, which actually I'm very excited. We have somebody that started this week in our office and he does evenings. So it's and he sees all ages. So it's great. But one of the things like I've noticed is, so I am a provider. I do a lot that does a lot of OCD treatment. That's one of my areas of expertise. And I am one of few providers in the Lehigh Valley that has the skill set to treat OCD effectively. And, I work in our office to disseminate treatment information and make sure like clinicians can get trainings and things like that. But we really do not have a lot of providers that treat specific diagnoses, especially in kids and adolescents. And so that's been a challenge. The other big thing that we've seen in our office, especially since the pandemic, is that we have a lack of higher level of care programs for particularly children and adolescents in our area. So for example, there's a type of program called an intensive outpatient. And it is a struggle to find that. Like, so when a kid or a teen can't, like general outpatient therapy once or twice a week isn't enough, and they need something more, throughout the week, multiple hours a day, it's really a challenge. And so finding a resource that's a good fit and can be helpful to that child or adolescent has been rough for us.
No. And Ronnie, before I'm sorry, but before you answer, sure. Just because I had to educate myself on what Clubhouse of the Lehigh Valley was. So can you give us a little bit on what the Clubhouse of the Lehigh Valley is, and then go ahead and yes.
Yeah, absolutely. So like the Clubhouse, to give a very short answer, it is a community center to support hope and healing for individuals dealing with mental illness, where they can find a place to belong. like the Clubhouse model is modeled after the original Clubhouse called Fountain House, which was opened in New York City in 1948. Pretty much the Clubhouse model embodies the belief that persons with mental illness can be productive and successful in both the workplace and their personal lives. There are over 300 clubhouses worldwide, and they all follow that same model, which is just like a world of caring and respect in which individuals with mental illness can have a place to find belonging and connect. So that's kind of like the short answer of it. And in like what I think is an issue, and and why I'm happy to be in the position that I am, is that like kind of echoing what they were saying about funding, is that like depending on what county you fall in, funding and support of mental health programs can be very, very different. And I'm very thankful that Lehigh County in particular, we work like at the Clubhouse with different organizations I'm involved in. We meet as providers with mental health administrators on the county level so that we can all work together and cut through kind of bureaucratic red tape on what is holding people back and, what missing pieces are. Yeah, I think that is a huge struggle. And then even in counties where the funding is there, and the support is there, like Lehigh County. I was just at a meeting yesterday where like they reminded me of the fact that like the wait list for like county funded public housing is something like 8 years.
It's crazy.
Is the wait for that. Yeah. So it's like, people dealing with mental health or intellectual disabilities, any of that, it's, when those kind of barriers exist to your basic social determinants of health, your basic care needs, that's a huge part of the problem too, is just, before you even get to the mental health is making sure that, basic needs like, do you have income? Do you have shelter? Do you have food is met as well?
Jacquelyn, Ronnie makes a great point here about resources. And in our last podcast episode, we were really talking about resources, but also in a way how it correlates with the stigma of therapy, of counseling. And I think it's not great that there is the waiting list that you had specifically talked about, but more and more folks are talking about how important mental health is to our overall well-being, to our communities, to our neighborhoods in general. And seeking counseling and therapy is much more common today than it has ever been. But there still is that stigma about it. And we've certainly been chipping away at the notion that, weak people seek out therapy. So I'm wondering, how, in your opinion, do we continue to chip away at this stigma that surrounds the counseling world in a way where people can feel safe? What are your thoughts?
Yeah, absolutely. Just talking about it, there's definitely been a shift where parents now, I work with children and adolescents for a good chunk of, my caseload, and they're so open to the thought of having their kid meet with someone one-on-one, and that therapy is, quote unquote acceptable now. And if it's talked about more, we feel more comfortable opening up about it. And if we as people talk about it and how wonderful it can be as a support system, it takes away that I'm not normal to, do that. So really opening up about it and having that honest dialogue. And there's been such a great shift in people understanding mental health, whether that's from podcasts or TV shows or books. So I just
comes down to education, right? It comes down to education, because I wonder, how do we reach those folks that say, you know what, people who go into therapy and counseling, they're just a bunch of weak people, just, get it together here. How do we reach those people? It's probably by education. That's what you're essentially saying here.
Yeah, educating people that it's okay. Therapists see therapists too. So just being open about it and saying how it's helpful and how positive it can be. And it's kind of the uncool thing to not go to therapy, like switching the script with that
Yep.
to make it seem like how this could be so helpful for you. Why don't you want to go? I mean, at the end of the day, you still need buy-in from the person, and they need to be open-minded about it. But the more we normalize that and talk about it, it really does chip away at that stigma piece.
It's really good to get this perspective from a clinical standpoint, from what you see on a daily basis. And George, I know you wanted to get into some more topics here with Amy Ronnie as well.
I like this question, and like I wanted for both of you, Amy and Ronnie, to answer. And then I guess Ronnie, my question is, with the Clubhouse, you have your members going out into the community. I'm sure you're giving them resources. And is stigma something that you talk about with them? Like, how is that something that?
So my answer to this is actually like just a little bit different than like it's still education, but I think it is education through peer support. Meaning, you are getting educated from about it with somebody with their own lived recovery experience.
Right.
Before I became the director of the Clubhouse at the end of November, I spent 6 years as a regional director for a peer support service. So what that is individuals with their own lived recovery experience being paired as just that, a support to somebody else currently in recovery and supporting them on whatever their goals and independence of. It was like a dream transition job for me to go into this role at the Clubhouse. Because I mean, at the Clubhouse, we're not really we are giving our members a place to be and belong and be surrounded and supported by their peers. So like somebody could walk into the Clubhouse. I mean, there are people there who have been members for 20 years at the Clubhouse. Yeah. Second day a new member walks in who's struggling with something. We've got somebody right there in house who can say, I remember when I was going through that in my recovery, and sit down with them in one of our rooms and directly connect them with that resource.
Acceptance. That's what you're talking about. There's a community of acceptance, and that's an important aspect of what this is.
Absolutely. At the Clubhouse, it's like I may be the director and we have staff who work there, but the members own that Clubhouse. They take pride in it and they help it operate. And so, someone coming into the Clubhouse who maybe they want to work, but they just don't know with their mental illness whether they have the skills to do so. Well, they can come to the Clubhouse every day and participate in the model of a work ordered day, where we have a list of things around the Clubhouse that need that help it run each day, and they can sign up for those things and pair with another member and learn those skills and build and in that not just build work skills but build social skills. And participate in meetings, become parts of decisions that are made for the Clubhouse, to really kind of just help us run and be successful. I think that is a huge way to eliminate stigma, is to just encourage others to surround themselves with people going through the same thing so they know that they're not alone.
Amy,
kind of the same thing for Amy. Sorry, I didn't mean to interrupt you, Jeff.
No, go ahead, buddy.
More for even with children, like, is there a stigma for the parents who were like, hey, I don't want to bring my kid in because something, how do you even deal with that?
Yeah.
Is it a different approach?
I've noticed like a huge shift in that. And again, like, I think something happened, as awful as the pandemic was, I think it forced us in some ways to really think about our mental health or our mental well-being in a time where we couldn't really do much else. And I've noticed since then, like, the parents are much more open and willing to bring their kids to treatment. I think some of this is, in places like schools, mindfulness and emotion regulation have become huge topics. I hear about, like, when I have a teen come in, sometimes they'll talk about how at lunch they were talking with their friends about their therapists and what they're talking about in therapy. And that was a huge thing. One of my favorite things where I really started to feel that stigma falling away a little bit is I was at an Iron Pigs game with my family, and a teenager that I was seeing at the time I saw him, and I let every client approaches me and they do whatever they want. I don't say hi first. He had a group of friends with him, and I saw him, and I was like, he's not gonna say anything. He comes up and he's like, Dr. Amy. And he's like, everybody, this is Dr. Amy. And he introduced me to all of his friends. And like, for a second, I didn't know what to do. But then I was like, this is so beautiful because, this is he was 16 at the time. And this is a generation that I feel like they're embracing their mental health a little bit more than even like, my generation, the 80s and 90s, we were just okay until we weren't.
Oh, yeah. Yeah.
And now I feel like the younger individuals, they're really seeing things and how beneficial it can be to have these different skills and tools. I think that's partly due to technology. I think, there are apps out there like Calm and Finch and those different things that are pretty popular and people like to use them to help with mental health. And, I know this one might be going away on Sunday, but TikTok was really huge in promoting some mental health stuff. Sometimes it wasn't great from the diagnostic perspective. We saw a lot of people coming in and being like, I think I have this, I think I have that. Because it's not always the most informative in that way. But like, I really feel like it dropped the stigma a lot for, there's a lot of creators out there that talk about their mental health, that talk about going to therapy. There are therapists out there disseminating information. And I just think, all of those things as a whole have really helped benefit us as a society and kind of figuring out that it is okay if you're not okay, and it is okay to go and get help.
I think the torch is being passed in a way, and I don't even know if I don't know if it is a torch. Maybe I should say that the light from the torch is getting brighter as it pertains to individuals of all ages seeking mental health. And you did mention the pandemic, and I really wanted to dive into that a little bit, Amy, if you don't mind. Even though life has been altered for so many kids, and there are still kids who are struggling with various mental health aspects from the pandemic, I'm wondering from a clinical standpoint, what can we do to ensure that they have paths to success, perhaps without that PTSD and trauma-based burdens from the pandemic, because those are very real things. And I think that at times is not being talked about enough, the PTSD from the pandemic that so many kids do have that may not realize they have it, and the trauma from it. How do we start to put them onto paths of success based on what they went through in the pandemic? Because some of this stuff is going to come back and start biting some kids.
Yeah, I agree. I think, one of the things that, I certainly encourage in my sessions with kids and teens, and when I'm working with their parents and sometimes working with their schools, is making sure we're really listening to them. One of the things that I find, especially with my like adolescent and teen clients, there's some that have amazing supports and they're listened to and everything, but there's still, one of the things I do see is that sometimes there is a lack of validation from the older individuals in their lives that think like, oh, you're fine. You were a kid. You were just in school. That was hard, but you're okay now. Yep. And I think, I have two children. I have a 13-year-old and an 11-year-old. And, I see differences for both of them. Like my 13-year-old was already pretty far along in his education. He had good, solid friends by the time he was in third grade, and he's kept them. My other son was in kindergarten, and like we've had to work with him on his social skills and, understanding like even things like making friendships has been different for him, because where I was friends with my older son's parents already, because William was in kindergarten when the pandemic happened, I don't know the parents. So like, even just things like that of trying to figure out how we can connect with each other and listen to our kids and listen to what they're saying and not minimize the fact that it was a very real and very scary thing for them as well, is definitely a huge thing. Yeah,
it's going to take some time for kids to heal from the pandemic for sure. George, I know you had some questions and topics you wanted to dive into, buddy.
Yeah, I wanted to ask Ronnie a little bit more, dive in a little bit more specific to the Clubhouse. Can you talk about, I don't know, like some specific things that the Clubhouse does in the community, just to give people like more of a kind of slice of what you guys do?
Within the Clubhouse itself, basic qualifying factors are that you need to be a resident of Lehigh County, have a mental health diagnosis, and be 18 years of age and older. Then once you become a member, you decide what unit that you want to work on. We have two different units in the Clubhouse: a team unit and a culinary unit. So the team unit helps with kind of more administrative tasks in the clubhouse. That is things like we have members who work to schedule orientations for new members, to help with processing our billing for the county, to creating our newsletters that go out to the community, updating our Facebook pages. So and then the culinary unit, we have a full like kitchen in the clubhouse, and we serve a $2 lunch to members every single day. Like a $2 healthy lunch. We have a snack bar that operates in there. And so members of that unit kind of like assist with lunch, help with the snack bar, help with like just general like maintenance tasks that need to be done around the clubhouse as well, with outreach, with like figuring out taking calls for who might want to participate in a social activity. So when you become a member there, you choose what unit you want to be part of. And you participate, and your participation is not forced. It's not mandatory. There are some members who come into the clubhouse and they, and like, we're not saying if you're here, you have to be working and participating. Mm-hmm. We are just happy that they are there.
Excuse my ignorance, but how does one get referred? Is it something where I'm like, how do I get in there? How do I?
Yeah, I mean, we have a referral packet, and in that referral packet, a licensed professional will sign off on it, on your mental health diagnosis, and then in that referral packet, they will also mark like, what are your goals? Are they social? Are they educational? Are they employment goals? So we know right from the beginning what we can specifically be helping you with, and try to pair you with another member. Within the clubhouse,
I'm sorry, I didn't mean to interrupt you, but I said, do you live there for a certain period of time?
No, it's not a place that anybody is living.
Okay.
Clubhouse operates on a work order day, so like we open at 8 a.m. And members will kind of like a lot of and the work order day operates from 8 a.m. to 4 p.m. And then we have social activities in the evening. So it's like 8 to 4 is the work order day, and then 4 to 7 is evening social activities.
And do you find, real quickly, like that social interaction, that peer-to-peer stuff, like that must be for a lot of the people who maybe don't have that healthy interaction? That must be
absolutely. So many of the members, I mean, they say like, this is my family. And when it was one of the most amazing interview processes I'd been through. Because first was a phone screening. Then once I got through that round, it was an interview, but it wasn't with a bunch of administration. It was with the director and about 8 of the members. And then the third step was just come spend a day here and see how members interact with you, because the members need to feel that, like that I said, it is their place. And there are just so many little worlds within the clubhouse. Like within that space, we like I said, we have a kitchen, we have a small library, we have a tiny thrift store where nothing costs more than $5. We have a stand that sells basic like hygiene needs, bus passes. So it really is this resource hub. I can't encourage enough that if someone lives in Lehigh County and they have a mental illness and they haven't visited the clubhouse, it is worth checking out, because it is really good work being done there that I'm very proud to now be a part of.
I think it's fantastic, the work that all three of you do in your particular space and in your particular corners here in the Lehigh Valley. But Jacquelyn, I wanted to kind of move in another direction here with your particular experience from a clinical standpoint. I'm wondering how, as again, it kind of going back to coming out of the pandemic, how therapy can be most effectively tailored for individuals with substance abuse disorders and addictions, because we know that there are so many folks within our communities that struggle with these challenges and struggle even genetically with them, and how community and family are adversely affected by substance abuse disorders, and just how addiction has so prevalent in so many ways. So I'll stop pontificating here. So again, in your experience, how can therapy for folks be most effectively tailored for individuals who really are suffering from addiction, from various substance abuse disorders?
Yeah, this is definitely a topic that hits home. Prior to being an individual therapist in private practice, my prior work experience was in the corporate world of addiction. So definitely most of the time currently, I may meet with families for intakes or to assess appropriate level of care. Typically, as Dr. Amy talked about, there's different levels of care, whether they need intensive outpatient, partial inpatient, detox even. So in my role now, I'll be more psychoeducational, informative to the families, like, here's the options, and outpatient might not be best at this time. But as effectively tailoring treatment, therapists really have grown since the pandemic and prior to the pandemic with new information, and that being a wider range of what sort of works for clients. It depends. I say a puzzle or a pizza pie. It depends like what kind of day it is.
Okay.
But my outlook is that there's a lot of pieces to the puzzle, or there's a lot of pieces to the pizza pie, where maybe treatment 10 years ago, even 5 years ago, we've grown a lot with medically assisted treatment, which for opiate users, alcohol dependent users, is a medical model in addition to therapy. We've grown a lot with medical marijuana treatment, especially in Pennsylvania, as that has become a thing. So it's kind of like what pizza pieces fit for that individual.
Yeah.
Where 12-step programming before NAAA, that was really like frowned upon, like that wasn't okay. Speaking of stigma, there still is some stigma with that, but some clients need that. And it's really tailoring, like, yeah, you have your coping skills, you have your support systems, maybe you have medication management from a doctor through, psychotropic medication options, but these are other things that do need to be tailored, that we're being more open-minded to, that there's a lot of trainings out there with. And it's just really important as therapists to know that those options are available, that it is okay for clients to choose them when appropriate, and being open-minded to that. Where, when I first started drug and alcohol treatment in 2008 or 2007, like, that wasn't, medical marijuana wasn't something we talked about. And there are a lot of clients who can benefit from it.
Yeah, absolutely.
Yeah. So I hope that answers your question, but overall, that's kind of my feedback with that.
Yeah, it absolutely does. George, I know you wanted to dive into some of the these topics as well.
We were talking a lot about adults. I mean, these are still adults, but children and adults. But college age people, right? A lot of them were that generation that had their proms removed. A lot worse than that. But during the COVID times when they were maybe graduating seniors, So, question to Amy, but then anybody could answer it too. Is there a different approach to some of those individuals who are adults now in their early 20s? Have you seen more of that demographic seeking therapy? And again, we said how it's a positive thing. So,
yeah, I mean, I think like I've seen when I started out doing therapy. So I've been a licensed provider since 2011, and of course, I had all my training and everything before that. And I was seeing, kids and I was seeing adults, and the college population wasn't as huge. And I would say, like, since the pandemic, like, that is like the largest population I'm seeing right now. So I have like a mix of clients, but I have a lot of college students. One of the funny things for me is that some of the college students that I have as clients are individuals that I saw when they were like 11 or 12 for anxiety or something like that. And then they were doing better. And so we ended treatment. And then as adults now, they've actually just had somebody reach out to me. Actually, a few people reached out to me this week that were like, hey, can we get back in your schedule? And some of them I haven't seen for a couple of years. So, I think.
But like I don't mean to interrupt, but it's just like they know, like, hey, I had a good experience. This worked for me.
Yes.
Yeah.
I can go back to it again a couple of years later. Right. Like,
yeah. And I think, I think that that's one of the amazing things too about, we're talking about how stigma has changed and everything like that. And with going back to therapy like that, a lot of my college students don't feel shame in that anymore. Like, I feel like there used to be this thing with adults and maybe, older teenagers that like, oh, there's something wrong. I need help. I'm not normal. And I think that that's changed. I obviously I'm very big on therapy. I have my own therapist and she's amazing. I don't know what I would do if I didn't have a session with her every week. So, I think that that's a big thing too, is like people are just, they feel differently about taking care of their mental health. And that's great. And I think that the college age students that I'm seeing now that were in the pandemic, there are still some social struggles and things like that. But I think one of the things that is good is that they're seeing somebody. And I know we see a lot of college students in our office. There's a lot of people calling in that are college age that need treatment. And I think having that support network is really helping them get through the trauma of being a pandemic, especially in such a crucial time in their life when they were maybe finishing high school or just starting college. I also, one of the great things about the Lehigh Valley is I think we do pretty well as clinicians. I was actually surprised that I didn't know Jacquelyn prior to this, because I think like I've seen her in like some Facebook groups and things we have, but we've formed a pretty good network of who sees this client for these issues, who would see, who is good with substance abuse treatment, because that's definitely not in my wheelhouse. And I think we work really hard as a community in this area as mental health providers to make sure that we're giving the people the support they need. We just maybe could use some more in certain areas. And I think that that's one of the things that we struggle with here.
I think
Jeff and I'm sorry, I just don't mean to interrupt, but we can attest to you all knowing each other.
Yeah.
But we organized this, via email, like before I got you guys together, and then you popped in, you're like, oh, Ronnie. And so it is, you do have that close connection. That's funny that you guys all kind of knew each other prior to even coming in. So.
It's cool. What I was going to say is that the theme that I'm getting specifically from this conversation is that we're getting better. We're getting better in various ways as it pertains to mental health, whether it's acceptance, chipping away at the stigma. And with our part 1 episode where we were talking to some public officials, and me being a public official myself, being a Northampton County commissioner and doing a bunch of outreach with regard to different legislators to see what we can do about funding, we're getting better, but our local communities need to get better, and our representatives need to get better about understanding what we are all talking about in this space here. So what are your thoughts about reaching those folks that are the decision makers? I mean, you've got one right here who's already on your side here. It's about convincing folks to make those strategic investments within our community's future, within mental health. So, Jacquelyn, I don't know if you want to start there.
Before you answer, I think that's great. I think it's a fantastic question to kind of end with, and I would really love to hear from everybody.
That sounds good. Sounds good, Jacquelyn. Do you want to start here?
Yeah, that's a loaded question, so I'm trying to gather my thoughts. My first thing was like, now I met Jeff, so now I do have a connection. It's important. My initial reaction is that in private practice specifically, I'm comfortable saying this, I sort of lose sight of those more larger global issues because you're just back to back, day to day.
Yeah.
So if anything, I'm re-energized and refreshed to be yeah, you're right. This information does need to be dispersed, and this platform is a great platform to do that. We utilize podcasts a lot to just listen to, and it's wow, it can be such a reach out source.
Yeah.
Because there is a disconnect day to day. Depending on our roles between Dr. Amy and Ronnie, you're just back to back, and you kind of get lost in that shuffle. And the other thing is the clients are so great at advocating for themselves and sort of, what's the word? Getting them to go out and encouraging them to also speak up for themselves.
Getting involved in the advocacy of it.
Yeah, my wheels are turning. I'm with Ronnie's position too. I'm there's so many clients who could outreach that way and connect. And Ronnie mentioned the peer-to-peer support. And I think Dr. Amy too, they're their best advocators when it comes to that. So we can advocate for them. But again, to kind of loop back full circle with the stigma, them advocating for themselves could just be so amazing to watch too.
Absolutely.
But you definitely have my wheels turning. And I think knowing you now, Jeff, too, and thinking about it, it's definitely something that we all need to make a priority to work together.
Absolutely. Absolutely. Yeah. Amy, what are your thoughts here?
Yeah, I mean, I definitely agree with everything Jacquelyn is saying. And I think, one of the things like, that I've seen and is not only, listening about my teens talking at the lunch table, I've had clients refer other clients. And I think that that's amazing. And, one of the other big things that we've tried to do in the last year with opening our community center Pieces of Mind is really do more community outreach. We have programs that we've started that all focus on mental and emotional health in some way, shape, or form. And that's just, maybe starting the ball rolling a little bit for somebody who's struggling with something and they come in for a program that's not technically therapy, but it's teaching their child. Like we have a summer camp called Camp Calm that teaches a child emotion regulation tools while they're in the camp. And then if they need more, they know, oh, this was okay. I also, one of the things I've been doing in the last year, just through having that community center is, I've been going to schools to talk to them about our programs and what I do as a therapist and why I open Pieces of Mind. Yeah. I just met with an ABA support services, applied behavior analysis type of therapy for individuals on the autism spectrum, and talked to them about the different things we can offer on Monday. I've just been trying to connect with as many places as I can in the community, schools and other programs that have some similar things, other therapists, just to try to build our connection and show the world that if we figure out how to work on this together and we can really, build a strong community through things like Clubhouse. Sounds amazing, Ronnie. I didn't know it was exactly what it was before this. And right. I'm so excited about it because it's such a cool thing. And I feel like, if we all come together, we're going to have so much more ability to, break things down and make everybody see that, it's good to be in therapy. It's good to get support. And maybe with that, we'll get more resources too when we see how much it can improve our society.
Absolutely. Ronnie, what are your thoughts just in terms of, this particular topic as we're closing things out here?
So one thing that I has just been on my mind that, I have learned over my years, of experience in kind of middle management role in this, is that tracking your data and outcomes of your services is very important. Because how do you make a difference and reach out to those people? It helps to be able to show real concrete evidence of this is how many people we are serving. This is how much of a difference that has been made. So you can lay that in front of someone who's saying, well, this doesn't matter. Well, I can show you, that, well, actually in this past month, we helped this many people find employment.
Yeah.
We it's I just think that's so powerful. The Clubhouse right now, we are on our way. Like I said, once you're a member for life, and we're heading towards our 2000th member at the Clubhouse of Lehigh County.
Fantastic.
Every month, one of our units puts out a newsletter, and in that newsletter, it will list every single one of our employees who has independent employment, supported employment, those who are working in our transitional employment, where we are with them as we partner with. That's a whole other, sect of
a whole other
something
podcast.
Yeah, for sure. But that's just something I think is important. Is when it is having those outcomes ready to, if somebody is debating you and saying that, that this doesn't matter, whether it's just a bunch of people, talking about their feelings or whatever, to be like, no, this is the real change it is making in the lives of individuals. So I just think that that's important. And I know at the Clubhouse, it's great to also have a space where all of those people are truly together. So then when it comes time for a rally, like at the Hill, for mental health awareness. We can put a bus full of members who want to, who want to make their voice heard and drive them up to Harrisburg. And we can, we have put on our wall who every single one of their, like government officials are, so that every day they come in the clubhouse, they know if they got a person to contact, there they are. And that's how you contact.
That's great.
And that's a great way to end. I mean, that's what we need to continue to do. Even the politicians told us to continue to bug them. That's where we got to get more funding and more support for the people like you. I mean, I think sometimes we forget you guys are humans as well, even though you are the ones where we say mental health funding, but you're dealing with all this. Your workloads are immense. Taking the time out to spend some time with us is much appreciated. And I learned a lot of stuff.
Absolutely.
About the Clubhouse. I really, Ronnie, what is just Google the Clubhouse, Lehigh County? Is that the best way to get started?
Clubhouse of LehighCounty.org. Come take a tour, spend a day with us. It is one of the most, it is heartwarming. I'm so thankful, to be there.
I'd love to come in if we could do something. I'd love to.
Because it's like for in between, wonderful therapists like Jackie and Amy, when you meet with your clients, but then they go back to their lives in between their sessions. And you almost like wish, like, man, that that they're going home to something rough, or they're signing off of that Zoom to something rough. There is a space in Lehigh County where they can be in between those things and be around people supporting.
Awesome.
And Amy, where can people find out more about you?
So for our practice, it is lvccfd.com. So that's my psychology practice. We currently have 10 clinicians that take on clients. We are hoping to add a couple more. And for Pieces of Mind, it is piecesofmind.org. And we have programs for all ages that are continuing on and we have for specific populations, like we have some programs specific for people on the autism spectrum, and, programs for kids and moms that need support in all those different areas. So
check out our episode. We've already done an episode. So.
Yes, we did a pre-holiday episode, which was great.
Excellent. And Jacquelyn, same question. How can people find out more about you?
Yeah, so the website is On Track Counseling. It's a little tricky because there's no C, so it's ONTRAK counseling.com. My email, my phone number, you can submit a form request on there. Also, like Facebook and Instagram, because you got to be a little hip sometimes with friends. Same On Track Counseling. Yeah.
Yeah, and we'll make sure that this is all linked in the show notes as well, if you can't remember all this stuff. So, Jeff, this was fantastic.
Great discussion.
I really appreciate all our guests.
Absolutely. Great discussion. Yes. Very much appreciate you. And George, buddy, I'm already looking forward to part 3 when we're going to be doing part 3 of our mental health series here.
But it's just nice to know that these conversations are happening and that you can have them and you don't have to feel weird about it. And, there's people out there who want to hear from you and want to do this. So from myself and Jeff, thank you guys so much. We appreciate it. And we'll see you next time. A big thank you to our partners for making these episodes happen. Banco Beverage Company, Molly's Irish Grill and Sports Pub, Michael Bernardin of Howard Schaefer and Associates with Remax Real Estate, WDIY 88.1 FM, and our friends at Wind Creek Event Center. Find out more at LVwithLove.com.